The staff survey really thinks about how we bring the people promise to life here at GESH, and a lot of the work that we do within the HR team is positioned around the people promise and thinking about how we can respond to what you say in the staff survey to make things better for you and with you. So I firstly want to talk about being compassionate and inclusive. We are compassionate and inclusive, and I've heard loud and clear through the survey and also these executive question time calls that sometimes when you have concerns, you don't always feel that they're addressed as you would like them to be. So we're bringing forward two new GESH-wide policies. One is the dignity at work policy, and the other is the grievance policy, which says really clearly how we will handle any concerns that you raise in relation to those processes. Now, this is important, particularly in Epsom St Helier, where there hasn't been a dignity at work policy before. And this really shows the process for how we will bring to life the respect value and really make sure that's embedded in Epsom St Helier. We're also reinvigorating our executive sponsorship of our 4 staff networks. There's already been a question in the chat about representation, and across the executive, we want to understand how it feels to work in GESH, particularly for those groups that are underrepresented, that we won't have necessarily first-hand lived experience ourselves. So we are wanting to reinvigorate our executive sponsorship. We're also rolling out bite-sized microaggression training across St George's to make sure that we're all aware of what microaggressions are and how we need to deal with those if we observe them in our teams, in our workplace. So we recognise and reward one another. How do we do this? Well, we want to be recognised, we want to be rewarded, don't we? And James has already talked about the GESH Care Awards. They're returning for a second year, and we continue to celebrate 25 years of NHS service across our organisation. Having a voice that counts. So lots going on in this space. So we are working with and alongside our resident doctors to improve their working lives in a number of ways. And we have a national 10-point action plan that we are delivering. We're also going to be introducing quarterly pulse surveys. So after this staff survey, we'll have quarterly pulse surveys so we can get more regular feedback and be even more responsive. We're moving to implement our talent strategy, and that will include introducing an inclusive board to mirror the GESH board, and that will not only provide a development opportunity for those people, but also support diversity in our decision making. We are running engagement sessions to help and empower managers to interpret their results and create action plans. And we're also piloting the What Matters to You programme in 10 clinical and non-clinical teams across GESH with a view to roll it out more widely. And this focus on the pillars of included, safe and supported. So we are safe and healthy. We are implementing the Sexual Safety Charter, and we've talked quite a bit about this. This week, we are publishing a brand new policy. It's new to both trusts about how we will tackle sexual misconduct when, very sadly, this occurs, as we know it sometimes does. And we need to be on the front foot, making sure that we're supporting those who come forward to tell us that they've experienced this. There's also a toolkit and e-learning available. We are updating a GESH-wide approach to preventing and reducing violence and aggression. I've seen this work firsthand. I think it's really powerful. So we'll definitely be talking more about how we prevent and reduce violence and aggression. And we've been rolling out GESH-wide bullying and harassment awareness sessions. We are always learning. We are always learning, aren't we? I certainly am. And we have increased the number of apprenticeships colleagues are accessing. We have our ongoing CDP for our clinicians, and I might touch on that later. And we are rolling out continuous improvement and high-performing teams to make sure we're all engaged in our work and we understand the strategic importance of what we do day in, day out, and we can improve it. We're also designing a new leadership and people management program, which will be piloted very soon, and it is designed based on the feedback we've had in the staff survey. We work flexibly. You will have heard me talk about this last month. We have a new policy on flexible working, and with the supporting resources and guidance and drop-in sessions and promotion events that we've been doing. This is not an easy topic for us. It's not always straightforward, but I believe we're making inroads and making flexible working more widely available, which is the right thing to do. And finally, we're supporting teams through organisation development and through helping people to upskill and facilitate their own action learning sets across various teams.